This is part 5, case number 3A, Advanced Cardiac Life Support for Religion 371, Nursing Ethics and Spirituality. Our case study this week was about Mr. Kind, who is a 71-year-old male with multi-system organ failure. Basically what happened was he was placed on a mechanical ventilator, and after the doctors did everything they could, they decided they did not want to proceed with treatment, and tried to move the patient to a no-code status or a DNR, do not resuscitate. The daughters disagreed, and wanted all measures, life-saving measures, for their father. And so basically what we did in this video is dissect and answer the questions that, where does the dilemma lie within the case study.
So this is Maria, and I am going to be covering virtue ethics. So the overview of virtue ethics is to stand firm on what is right in difficult situations and showing good judgment overall. I think that from a virtue ethics point of view, it's better to stop aggressive treatment for Mr. Kind and put him on DNR and provide only comfort measures. The reason that I came to this conclusion, and I think that this is the better option, is because the physicians has already said that they feel it's not right to continue aggressive treatment. And also, if you look at Mr. Kind's 3 hospitalizations that were mentioned in the case study, it's a lot, and all of them were like emergency cases, and it puts a lot of suffering and strain on Mr. Kind. And I think that all of the 3 hospitalizations show the same assessment results of it being that it's better to provide only comfort measures and put him on DNR, and it would be in the best interest for Mr. Kind. It also mentions in the case study that his 3 daughters all quit their jobs to care for their father. And even if aggressive medical treatment were to be continued, it doesn't mean that Mr. Kind would be back and healthy and, his illness would be cured. So he would still have, it would have an impact on his quality of life. And on top of that, it would be a huge financial burden on his daughters, who all 3 don't have jobs. And Mr. Kind would not really be able to live a long, healthy life and be magically cured, even if aggressive treatment is continued. So if we think about quality of life and not just being alive, it's better to provide comfort measures so at least he won't be in pain and suffering. Hi, this is Maria, and I am going to be covering the utilitarianism method. So the main point of this is calculating the benefits and the good and comparing it to the bad versus and the pain. So trying to have the greatest good for the greatest number of people involved. And in this case study, the parties involved are Mr. Kind, who is the patient, Mr. Kind's 3 daughters, Mr. Kind's physician and medical team, and the hospital that Mr. Kind is receiving medical treatment. So the 2 options here are to either stop aggressive measures for Mr. Kind and put him on DNR and provide only comfort measures, or the other option is to continue the aggressive treatment and keep him alive for as long as possible. So the conclusion that I came up with for this method of thinking is that from this point of view, I would say to continue aggressive treatment for Mr. Kind. The reason I came to this conclusion is that if we outweigh the good and the harm and think about all of the parties involved, first off, there's Mr. Kind's 3 daughters who all want the same thing, which is to continue the aggressive treatment for their father and keep him alive for as long as possible. There is also the hospital, who would want to avoid any lawsuits or problems from the patient's family, in the case that the medical team would want to go against the family's wishes. And also, although the physicians want to request to put him on DNR because they think that it's unethical to continue treatment, they most likely will probably want to avoid any lawsuits or problems with the patient's family as well. And in the case study, it mentions that the daughters were threatening to potentially, make this into a legal matter if they did not follow their wishes. And as for Mr. Kind, we don't have any input on what he would like, but we have to consider that the case study does not show it says that he's unconscious, so he doesn't really have his input on the situation. So overall, if we balance out the negative and the positive and the good and the bad, it would bring more happiness or benefit to the people involved if we continue the treatment rather than stop the treatment. But one thing I wanted to put in and consider is that the fact that Mr. Kind is the patient, so providing the most happiness and positivity, like the best decision for him, may have a greater weight than the other people that are involved.
The autonomy view. Autonomy means to provide all the information needed to allow patients to make their own decisions based on beliefs and values. In this situation, the decision cannot be made by Mr. Kind at his third hospital visit, and he is placed on his vent. Mr. Kind has 3 daughters who are advocating for his health and care. Mr. Kind's 3 daughters want the healthcare team to continue care upon cardiac arrest. However, Mr. Kind has already been declared DNR and signed all of the forms. As a nurse or even a doctor, we should explain what this means to the family. We should have a thorough conversation answering any questions or concerns that they may have.
The deontology method follows the theory of following moral duty, regardless of emotions. Our decision was based upon the fact that the physicians must ultimately respect and follow the decisions of the patient's daughters to continue treatment as they are the power of attorneys. Our reasoning was based on the fact that deontology emphasizes intention, and as powers of attorneys, the daughters only have their father's best interest at heart, even if their decisions were made by their emotions. In addition, Mr. Kind is well taken care of, and until he is not, there is no reason to force treatment to discontinue. The nursing ethic of non-maleficence refers to the obligation to do no harm. Our decision to follow the virtue ethic of non-maleficence shows it would be in Mr. Kind's best interest to transition to comfort care. However, since the daughters are power of attorney, this is not possible. Additionally, Mr. Kind is physically stable, so non-maleficence is still upheld. Our reasoning is that Mr. Kind is free from infection, bed sores, and other medical difficulties. Therefore, non-maleficence remains at the center of the daughter's reasoning.
Beneficence. Overview. An act of charity, mercy, and kindness with a strong connotation of doing good to others, including moral obligation. In this situation, it seems that Mr. Kind's physician is making a request to have him no code because of the health state that he is currently in, which is multi-system organ failure. His kidneys are not working correctly, and he has non-small cell lung cancer with metastasis to the liver. Also, he has been unconscious for 5 days. The doctor in this situation is trying to keep the patient from the least harmful procedures possible, which are to make him no code and to stop aggressive technological interventions, which in this situation shows that the doctor is doing what he thinks is best for his patient at this time. He's trying to include Mr. Kind's daughter in this intervention as well. At this time, the best way to provide comfort and care and to provide dignity for this patient.
In the Catholic healthcare, there are specific directives that reflects the Ministry of Health in correlation of the Church. The purpose of these directives is to create a mutual understanding and a plan of care that reflects the religious values of the patient while providing adequate health. So the directives that can address the ethical issues in this case study are Part 3 and Part 5. Part 3 is the professional-patient relationship. Section 24 states that we encourage and respect advanced directives. Section 26 and 27 state that we honor the patient's right to make treatment decisions and respect informed consent. This section plays a huge role in Mr. Kind's case as he has signed advanced directives when he was alert and oriented at his first hospital visit. Also supporting Part 3 is Section 33. We also consider the whole person when deciding about the therapeutic interventions. We should explain to Mr. Kind's 3 daughters maybe that this would help them put their minds at ease. The doctors and the nurses have tried everything they could to help their father with however much time he has left. Maybe if they knew this, they wouldn't be pressing charges. Then finally we have part 5, and this is issue of the caring of the dying. Section 55 states that we help patients prepare for death. The doctors and the nurses can do this by providing any information to the patient or the Mr. Kind's 3 daughters they have of dying.
In conclusion, the ethical considerations surrounding Mr. Kind's medical care underscore the delicate balance between beneficence and non-maleficence. While the principle of beneficence emphasizes promoting his well-being and maximizing positive outcomes, non-maleficence reminds us of the importance of avoiding harm, particularly in the face of futile or overly aggressive interventions. In this complex scenario, the initial physician's recommendation to focus on comfort care and limit aggressive technological interventions align with both beneficence and non-maleficence. By prioritizing Mr. Kind's comfort and dignity while avoiding interventions that may cause unnecessary harm or prolong his suffering, the healthcare team seeks to uphold his best interests and respect his autonomy. However, navigating the differing perspective of Mr. Kind's daughters requires a delicate balance of empathy, communication, and ethical decision-making. While their desires for aggressive interventions may stem from a place of love and hope, it is essential to ensure that their wishes are carefully considered in light of Mr. Kind's medical condition and overall well-being. Ultimately, the goal of medical care for Mr. Kind should be to provide compassionate, patient-centered care that respects his autonomy and dignity while also adhering to the principles of beneficence and non-maleficence. By engaging in open dialogue, empathetic communication, and shared decision-making, the healthcare team can strive to provide the best possible care for Mr. Kind during this challenging time.